Justin Bieber is getting a lot of attention on social media right now because of concerns about his health. He's had to cancel a couple of concerts, and he took to Instagram just the other day to explain why. To explain that he is experiencing partial facial paralysis.
I wanted to update you guys on what's been going on. Obviously, as you can probably see from my face, I have this syndrome called Ramsay syndrome.
That is something you may not have heard of before, certainly extensively. So we're going to learn about it this morning with Dr. Christopher Labos, who's an epidemiologist and cardiologist in Montreal. Good morning, Dr. Labos. Good to see you this morning.
Good to see you too.
So watching that video, listening to Justin Bieber say he has this rare condition called Ramsay syndrome, number one, what is it and what is it caused by?
So it's basically caused by the chickenpox virus. A lot of people have been asking, is this Bell's palsy? And it certainly looked like Bell's palsy when you watched the first 30 seconds of the video. But Ramsay syndrome is specifically a facial paralysis caused by the chickenpox virus, usually when the chickenpox virus reawakens. So because everybody who got chickenpox when they were young still has the virus inside of them, it can reawaken at some point later in your life, and it usually causes the shingles rash that many people might be familiar with. But when that shingles affects the side of the face where the facial nerve is, it can damage the facial nerve and temporarily paralyze it, which gives you that paralysis on half of your face. So it's basically a consequence of chickenpox.
So a consequence of chickenpox, paralyzing the facial nerve. If we can go back to the video of him again on Instagram, we don't have to listen to it. But what's interesting is, as you look at it, Dr. Labos, he can't even close his eye. The whole thing, nothing is moving, right?
Right, and that's one of the main consequences of this, because if you can't close your eye, you can actually really easily damage your cornea. I mean, blinking is a reflex that we have to protect our eyes. So a lot of times people, when the paralysis is pretty severe and you can't even close your eye completely, you sometimes have to have people wear an eye patch, because otherwise, dust, specks of dirt, what have you, can get into your eye and scratch your cornea, and that can be pretty serious sometimes.
You use the word temporary. What is the prognosis for this? Is it temporary or could it be permanent?
Well, it could be permanent. It's usually temporary. When you have the more milder forms like Bell's palsy, which is usually of unexplained cause or due to HSV as a virus, that usually does recover. Ramsay tends to be more severe than run-of-the-mill Bell's palsy variants. But I mean, if it's severe and you treat it, usually with antivirals, you generally expect most people to recover.
So that would be the kind of treatment he's receiving right now, courses of antivirals.
Presumably. It's a bit of an odd situation, though, because if anybody's ever had shingles, I mean, it's very, very painful, and you have a very visible rash. The fact that he has nothing manifesting on his face is unusual, but then again, sometimes patients don't read the textbook, so it's a bit of an unusual presentation. But the end result, whether it's Bell's palsy or Ramsay the end result is the same. Half of his face is paralyzed, and it's because the facial nerve has become affected.
Okay, so we'll watch this. But of course, today, Dr. Labos, when anything unusual happens in a medical sense, people automatically are going to COVID. Is there any potential correlation with COVID or the COVID vaccine to something like Ramsay?
Well, the COVID vaccine, no. I mean, this has been looked at. I mean, COVID, possibly, essentially any virus can cause damage to the facial nerve. So this situation presumably due to chickenpox. HSV is another one, but any type of infection could potentially do it. Even just a regular ear infection could potentially do it if the right circumstances occur. But is this specifically linked to COVID? I mean, he has no recent history of COVID. He had gotten COVID a few months back, but it would be unusual for COVID to be manifesting itself now. This is probably some other cause, and presumably, if what he's saying on the video is accurate, that it was due to chickenpox.
Okay. HSV, just for anybody following along, you've used that term. Is that herpes simplex? Is that what that is?
Exactly.
Okay.
Yes, exactly.
Herpes simplex virus in that particular case.